Wilfred Bion, a pioneer in psychoanalytic thought. Wilfred Bion, 1897 to 1979, is one of the most influential figures in modern psychoanalytic theory, particularly known for his innovative ideas on group dynamics, thought processes, and the role of the mind in processing emotional experiences. His work bridges the fields of psychoanalysis, philosophy, and epistemology, making his contributions vital for understanding both individual and group psychology. Early life and influences. Bion's early experiences, especially his time as a tank commander during World War I, profoundly shaped his thinking about human nature, trauma, and the emotional life of groups. After the war, he pursued a career in medicine and eventually trained as a psychoanalyst in London under the tutelage of Melanie Klein, whose theories on early childhood development deeply influenced him. However, Bion would go on to expand and transform Klein's work, particularly in his exploration of how the mind processes thoughts and emotions. Group psychology and group dynamics. Bion is perhaps best known for his pioneering work on group psychology, which he developed while working at the Tavistock Clinic in London. In his seminal book, Experiences in Groups, 1961, Bion introduced the idea that groups operate on two levels: the work group, which is focused on the conscious tasks and goals of the group, and the basic assumption group, which operates unconsciously and is driven by more primitive emotional forces such as dependency, fight flight, or pairing. He observed that when individuals come together in a group, they tend to regress to more infantile states of mind, often seeking a leader or adopting defensive behaviors to avoid uncomfortable emotions. These unconscious basic assumptions often derail the group from its conscious objectives, leading to conflicts or dysfunctions. Bion's insights have had a lasting impact on how group therapy is conducted and how organizations are understood and managed. Theory of thinking and the container contained model. Another major contribution of Bion was his theory of thinking, which he explored in his writings on psychoanalytic technique. Bion argued that thoughts and emotions are initially inchoate and unformed, and that the mind must digest them to make them meaningful. He introduced the concept of the container-contained relationship, where the container, such as a therapist or a maternal figure, helps the individual, the contained, process overwhelming or difficult emotional experiences. This model of thinking and emotional processing emphasizes the importance of relationships in mental development and psychic growth. It suggests that individuals are not born with fully formed abilities to think and process emotions, but rather develop these capacities through the help of others who contain their emotional states. O and the search for ultimate truth. One of Bion's more philosophical concepts is O, which he described as the ultimate unknowable reality or truth. Bion believed that psychoanalysis was not just a method for resolving psychological conflicts, but a way of approaching deeper truths about the human condition. O represents a kind of mystical or spiritual dimension in his work, where the task of the analyst is to help the patient move closer to an understanding of truth, even if it is something that can never be fully known or articulated. Bion's insistence on the pursuit of truth, both in the analytic setting and in life, has influenced not only psychoanalysis, but also broader philosophical discussions about knowledge, reality, and the limits of human understanding. Bion's legacy. Bion's work remains highly influential in psychoanalysis today. His insights into how individuals process emotions, how groups function, and the role of truth in psychological life continue to be explored by clinicians and theorists alike. His ideas have also been applied in fields such as organizational consultancy, education, and even politics, where understanding group behavior and emotional processing is critical. Bion's approach to the mind is both practical and profoundly philosophical, making his work resonate with those seeking to understand not only the clinical aspects of human psychology, but also the deeper existential questions of being. His legacy lies in his ability to bridge the gap between clinical practice and a more expansive view of human thought and emotion, offering tools for both healing and philosophical inquiry.